Welcome to Pathology here at Sherwood Forest Hospitals. I'm Ricky Thomas, the Head of Pathology Operations. Within Pathology at Sherwood, we have a breadth of services, including clinical chemistry, blood transfusion, haematology, microbiology, cellular pathology, and we also have point-of-care testing and the mortuaries. We analyse a range of sample types, including blood, urine, tissue and other bodily fluids, to screen, diagnose and monitor the efficacy of treatment for our clinical service users.
Hello, my name is Carly. I'm a newly qualified biomedical scientist within the clinical chemistry team in pathology. In clinical chemistry, we offer a 24/7 service, 365 days a year, working various shifts to process nearly 3,000 samples a day. These include night shifts.
We receive approximately 3 million requests per annum, which go through our central services team and are processed equating to approximately 8 million individual tests per annum. Alongside core services, we are also working on improvement projects, including the implementation of a joint laboratory information management system with NUH, and specific to cellular pathology, we're also working on implementation of digital pathology.
My name is Sidra Kalsoom and I'm a specialist biomedical scientist in cellular pathology. Cellular pathology or histopathology is a study and diagnosis of diseases of tissues and cells which are examined using a microscope. Currently, I'm also leading on a very exciting project of implementation of digital pathology in our department. So digital pathology is the process of digitizing the glass slides using a whole slide image scanner and then analyzing these images on a computer screen instead of a glass slide. This in turn will improve immensely with patient care, it will improve the cancer pathways, and it will also support the cellular pathology workforce by making diagnosis and monitoring of these diseases much more efficient.
I'm Joe Spooner. I'm one of the senior biomedical scientists here in microbiology, and I'm also the department's training officer. In microbiology, we process around 30,000 requests a month, testing for bacteria, viruses, parasites and fungi. We perform investigations on a range of sample types, from urines to bloods, swabs, respiratory samples and many more. Our antibiotic bench is one of the central points of the laboratory. Any significant bacterial isolates pass through this section, so we can perform sensitivity testing on them, which allows us to provide antibiotic results for patients in the hospital and the surrounding community. Microbiology are an integral part of the blood culture pathway. Blood cultures are loaded onto our analyzer 24 hours a day, so then we can detect patients that have sepsis within the hospital. We currently test for COVID a lot less than we did during the height of the pandemic, so we're currently looking at ways that we can repurpose the analyzers that we use for this testing within the laboratory.
The types of samples we do testing on include blood, urine, faeces, cerebrospinal fluid and other bodily fluids. We use automated analyzers as well as manual testing. We process samples from a variety of areas, including A&E, local GPs and community hospitals, as well as all inpatient samples. We are a small dedicated team who have a mixture of registered specialists and senior biomedical scientists within chemistry. Some examples of the types of tests we do in chemistry include liver function, kidney function, water balance, cystic fibrosis, multiple myeloma screening, genetics, bowel disorders, clinical trials, COVID antibody testing, therapeutic drug monitoring, diabetes and subarachnoid hemorrhages.
Thank you for watching this video. I hope we provided valuable insight into the pathology service we offer to Kingsmill, Newark and Mansfield Community Hospitals. We are honoured to strive and continually improve the services we provide. If you have any thoughts or suggestions on how we can further improve our services, please don't hesitate to get in touch with a member of the team. Thank you.